Hello, welcome to our channel. My name is Dr. Frank Amakwini, and this evening I'm here with my beautiful wife who is behind the camera. So we'll be discussing a lot of questions. Today is World Health Hygiene Day, so we're going to answer most of the questions on TikTok. Most of the questions you have asked concerning your menstrual cycle. However, if there are any other pressing questions that are not related, we still answer them anyway. So she will go through the videos, pick the questions, she'll read them out to me, then I'll give you some answers which may help you in terms of having control over your menstrual health. Over to you, Dr. Hey, Mrs.
Hey, really? Doctor, because medical school have been.
Over to you, Mrs.
All right, so this one is from Rice Beats GH. She wants to know. She says, Doc, please, my menses comes only 3 days a month. Is it normal?
Okay, so your menses should come between 2 days to 7 days. So you should bleed for between 2 days to 7 days. Any days in between is fine. So you can bleed for 3 days, it's okay. 4, 5, 6, it's okay. If you are bleeding for a day or it's not coming at all, or you are bleeding beyond 7 days, then you need to seek for help. Otherwise, 3 days is okay, 2 days is okay.
Okay, Mami Quenya says, Doc, please, are cramps normal?
Cramps, there are two types of it. There's a primary, cramps are known as the dysmenorrhea. There are two forms of it. There's a primary dysmenorrhea and a secondary dysmenorrhea. The primary dysmenorrhea is normal, okay? We can manage you on pain medication, that is if it is interfering with your activities and all that, and you'll be fine. Usually after your first delivery, the primary dysmenorrhea goes away. But for secondary dysmenorrhea, it's being caused by some other conditions like fibroids, polyps, and all that. So we will need to take care of that root cause of the cramps so that you can be fine. If you're having primary dysmenorrhea, which is relatively normal, with that, it starts usually some few months after your menarche. So the very first time you had your menses, that is the menarche, usually after 6 months after your menarche, you start feeling those pains. Okay, but for secondary dysmenorrhea, usually women in their 20s and their 30s are the ones who experience secondary dysmenorrhea. So when you started menstruating, you were fine, no pains whatsoever. But as soon as you turn 20, 30, you started having these pains. With that, you need to check out. But be as it may, once you're having menstrual cramps that is severe enough to interfere with your daily activities, I would advise you to come to the hospital. We'll check you out, and whatever it is, whether primary or secondary, we'll give you some management so that you can have a normal or relatively normal day even when menstruating. Okay, let's take the second one. The next one, sorry.
The next one. Ohima Abigail says, my sister gave birth last year, November, but still hasn't gotten her menses. Please, is there any problem?
Yeah, there is. So, when you are lactating, okay, usually or in most cases, when you are breastfeeding, you may not be getting your menses, but maximum after 6 months, you should start seeing your menses. So if you have gone up to a year and not seeing your menses, then most likely your hormonal status may be a bit imbalanced. So you want to check up at the clinic. We will do a hormone panel for you. Also, check up for any other causes of amenorrhea, and we'll help you out. Okay, any other question?
Yes. Please, my friend is AS and her husband is AA, but their son is AS. He's always sick. Please, what's the problem?
Okay, so this is unrelated to menses, but
Yes,
I think I spent some time on sickle cell the previous week. So AS individuals can have what we call the AS crisis. The AS crisis. So if unfortunately you are AS and still having crisis, then you need to look into a sickle cell clinic. We'll manage you as such, okay? And then give you some medications that will help you produce less of the S and more of the A, or in other circumstances, help you produce more of the hemoglobin F, which will help reduce the frequency of the crisis. So if you're watching, you would want to advise your friend to let the child or to go with the child so that they can book into a sickle cell clinic so that they can be managed from that point.
Destiny is Please teach us about nocturnal.
Nocturnal enuresis.
Okay, so the spelling Joseph Kobo. Kamika Kulobo. Almost. Kamigwai.
Okay, so
please teach us about nocturnal enuresis in adults.
Okay, so bedwetting, that one too, there can be primary, there can be secondary. So what happens is that with primary, it means that you have never seen a dry bed. You are always bedwetting, right from childhood to adulthood. For the secondary guys, they were okay, normal, nothing was happening until at a particular age when they started bedwetting. Okay, so bladder control, usually after 2 years, we start training you, toileting, bladder control and all that. Maximum 7 years, you should be able to control your bowel and then your bladder so that you know when and at what time to go and empty your bladder. Unfortunately, for some few individuals, they may keep bedwetting, or even for some adults, they may start bedwetting. If you are bedwetting, one, you need to check some habits, eating habits, drinking habits, and all that. If it's happening in the night. So you want to take in less water in the night. Okay? If you are an adult, you may want to set an alarm so that if you're having the urge to urinate or not, you would go and empty your bladder to prevent you from bedwetting. Normal or average individuals should urinate maximum 2 times in the night. Pregnancy, diabetes, and other conditions may cause you to, prostate disease may cause you to urinate more than the 2 times, okay? But if you don't have any of these conditions, the maximum 2 times. So if you're an adult and you are bedwetting, maybe what you want to do is to set an alarm 3 or 4 times. That is after every 3 hours in the night, you would want to set an alarm so that you can wake up and go and then urinate. Once you train yourself a bit on this, you'll be able to have control over your bladder. For children, there is what we call an alarm therapy. Alarm therapy. This is a bit different. It's an alarm system that is placed in their panties. Okay, so anytime the child bedwets, the alarm goes off, the child feels the vibration or the sound and wakes up. In some children that experience deep sleep, they are not able to wake up, so their parents may have to find a way of waking them up. In most of these children, the alarm therapy works for them and they are able to have control over their bladder after a time. If all these fail, then you have to do some pharmacological therapy for you. Okay, but there can be other reasons that may cause the nocturnal enuresis. Bladder disorders, okay, some neurologic disorders can all result in having bedwetting. So if you are living with someone who has that problem, you need to provide that person some psychological support as well. Otherwise, depending on the self-esteem and all that may be affected and all. So if it is really worried, you can try any of these, but I would equally recommend you book into a hospital or a clinic, then we can medically manage the condition for you. Miss, over to you.
This Gideon Kofi Fosu Zavi. Hey, wow. Please, my wife went in for 3 months family planning, and after that, her menses has stopped coming. Help us.
Okay, yeah, so contraception can interfere with your menses. So there are a lot of contraceptives that are available for use. So anyone that affects your health in one way or the other, or your psyche in one way or the other, we try to adjust so that we can change to another contraceptive for you. Okay, so yes, within the time where you have taken the 3 months contraceptive, you still should be having your menses. So it shouldn't be that after you take the contraceptive, you will not have your menses until the contraceptive has gone off your body. The first month you took your contraceptive, you still should have your menses. The second month you should have it. The third month you should have it. Okay, so for those of you who are watching and have just taken maybe the 3 months option, you should know that you should still be having your menses. Okay. If after the 3 months you still not having your menses, then you need to come to the hospital. We'll check your hormones and then we'll check any organic cause that is resulting into the amenorrhea. Okay, so just come to the hospital, we will check you up and you'll be fine.
Doc, please, my menses doesn't come. It sometimes comes in 6 months' time, and I've been to various hospitals and I've had various scans, but they're saying nothing is wrong with me. What could be the problem?
So your menses is under the control of your hormones. Anything that can jam your hormones in any bit or any form of it can affect your menses. Okay, I think in one of the videos I gave you some 10 reasons why you may miss your menses. I mentioned PCOS, that's the polycystic ovarian syndrome. I mentioned hyperprolactinemia. I mentioned excessive stress, excessive exercise, excessive weight changes, some medications, premenopause or perimenopause or menopause itself. All these can cause you to miss your menses. So yes, you may have been to a lot of hospitals and you're not having the needed results. At this point, you need a specialist to book into a gynae clinic. And at that level, you have a specialist who is specifically trained to take care of the difficult aspects of all these menstrual problems, and you'll be fine. Okay, so get a specialist wherever you are. Get a specialist, and that person will be able to help you navigate the problem. Please, over to you.
Please, I did 10 years family planning, and it's been 3 weeks now, and I'm still seeing my period. I hope I'm safe.
When you take any form of contraceptive option, you still will be seeing your menses. Just that it may prevent ovulation or it may prevent implantation. So your menses, you should still be seeing your menses. So it is normal. There's nothing wrong with you seeing your menses after taking an IUD or any form of contraceptive. Over to you, Mrs.
What if you are not pregnant but you don't see your period for a year? What should you do?
So I think I've mentioned this in the earlier question. I think the same answer goes to the person. You need to book into the hospital. We'll check you up and the menses will come.
Please, I've been seeing some discharges, and whenever I go to the lab, they will say it's candy and they will give me medications. Yet it will come again and okay, the question is not complete.
It's not complete. Okay, so anytime you're treating for these kind of infections, it is better both of you treat, you and your partner. Otherwise, you go back to the problem. Okay, and if you use a public facility for your toileting and all that, you would also want to reconsider that. Okay, so one thing is that after the treatment, when you go back to your old panties, you would, or it's possible you can catch the infection again. So you either want to change your underwear, your panties, and all that after the treatment, or boil them. Boil that any residual fungal elements can be taken care of. Make sure your partner is also equally treated. Yet again, there can be other vaginal infections that are not fungal or candida. It can be vulval vaginitis, there can be bacterial infections here and there. So you should be very sure that it is candida. It's not all vaginal discharges that are white or that are candida origin.
Please, what can delay a lady from menstruating as at the age of 21?
You have never menstruated, so that is primary amenorrhea. Your menarche, that's the first time you have your menses, should be between the ages of 9 and 14. After 14, if you have not had your menses, ever, don't be at home. Come to the hospital, we'll check you out, okay? So you should have your menses latest by 14 years. After 14, check up. So if you are 21 and you've not had your menses, Charlie, let me tell you, the hospital will help, okay?
Is breast pain before menses normal? My breast is really hurting.
Oh, sorry about that. Yes, some women do experience that. Okay, it's normal to some extent, yes. But if it's affecting or interfering with your daily activities, then equally you want to seek for an intervention so that we can help you manage that pain.
Okay, girl boss, say what causes swollen ovaries and fluids in ovaries?
So ovarian cysts, there are forms of it, a lot of it. Hormonal origin, or menstrual cycle can equally cause that. Pregnancy can cause that. So usually some of them will resolve, others may undergo what we call accidents, torsion, bleeding, infection and may cause severe pain. So in that situation, you will need to help manage you. But if it's not giving you any symptom, you're not having distended abdomen, you're not having any bleeding into it and all that, then was just picked up on a scan. It's not giving you any symptoms and you are not after menopause, you are within your reproductive age, then you may not be worried about it. But if it's giving you pain, severe abdominal pain and all that, then you have to come to the hospital. We will help you manage it.
Please, can sex during period cause pregnancy?
Not likely. Not likely. But sex during period is a no-no. It's a no-no, okay? It can be a recipe for you to catch infections. And for women, there is an infection we call PID. The blood is a good culture medium for most microorganisms, okay? So once you get infected during that period where you are bleeding and all that, it is easy that the microorganisms may multiply and they ascend your reproductive system into your tubes and into your ovaries and all that, and you can have some severe complications out of that. So just avoid sex during your your menstrual period, okay? I'm sure that 7 days or 3 days will not do you any harm. Okay, don't do agado.
Okay, the pregnancy symptoms are shown, yet have been seeing my menses, but pregnancy test proved negative. Please, what caused that?
So pregnancy symptoms, though you are not pregnant, is your hormones that are playing tricks on you, okay? Pregnancy and all the symptoms of pregnancy is as a result of your hormones, your progesterone and your estrogen. So equally, if it is interfering with your daily activities and all that, then you need to check up at the hospital. We have a means of checking the hormonal levels and comparing them to the normal so that we can help you manage that hormonal levels to bring down the symptoms so that you can have your normal life. Okay, so if it is really interfering with your daily activities, you need to come to the hospital. We can help you on that as well.
Asada wants to know what makes menses become black.
Black. So if the blood stays in there for a while before it comes out, then definitely you're going to turn black. Okay. So is that the normal blood? The normal blood, if you leave it there for days, it turns from that red to that black color. Okay. So that is it with you. Saying that. So I think that I want to thank you all for being part of this educative section. If you have any question, if you have any contribution whatsoever, you can equally leave it below this video in the comment section. I'll pick them again and I'll be able to share some thoughts with you. Okay, so my name once again is Dr. Frank Amokwine. If this video was helpful for you, you want to share the link, you would want to subscribe, and you want to also like this video. Thank you all for being part of this session. Thank you.
And my name is Juliet Amokwine. You forgot to mention my name.
Her name is Mrs. Juliet Amokwine.
That's what I said.
No, you said your name is Juliet Amokwine.
Mrs. Juliet Amokwine.